I want to thank you so much. Welcome to the GAPS Georgetown Area Parkinson Support Group. I'm Mary Jane Berry, and many of you guys already know me. If you don't, be sure you sign up to get my newsletter. You'll get to learn all about me through the newsletters. People give me a hard time, it's lengthy, but then people say they really enjoy reading all that stuff. It lasts them all month. So there's always something going on. Hey, I just want to be sure and do a shout out to all the folks that come. We actually start setting up around 1 o'clock here just to get this together. It seems like one of the biggest things and hurdles is our AV and our Zoom and getting all of that done. But I want to thank our Zoom team back there, which is Don and Deb. They're in the back. And this is how at the newsletter, when I send that out for the next month, you'll have a link to the meeting. And so that you can go back and look at it. Also, though, we have people like Tom and Stan who come here early, as well as Gail and Wayne. And then we got the whole folks that are sitting up there, setting everything up. And of course, Patty, my right arm and my left arm. I know it. Patty is awesome. If you don't know Patty, y'all got to get to know her. But I want to thank everyone for helping out. We have door prizes. We got some great door prizes, by the way. We'll be giving out several of them and then saving some. But if you did not get your ticket, be sure you get your door prize ticket from my husband. He's the one who gives them out. If he promised you a car, I am sorry. He's been watching Price is Right too much. A lawnmower this time. Yeah. He just watches Price is Right and he thinks he can give everything away. But anyway, be sure you get your ticket.
What?
All right, the agenda, of course, as you know, when you come at 2:30, the whole reason is to socialize, to get to meet our wonderful sponsors, to have some cookies and just to check everything out. So we always encourage you to come at 2:30 and kind of just come to meet everyone. And this is your chance because with Parkinson's, socialization is really, it's stuck hand in hand with exercise and with medications. And so that's why we really, really want you to come and socialize early. So thank you for coming early. I'll be doing some announcements here in just a minute. Dr. Maria DeLeon is awesome. I have heard her speak several times. She's really, really good. She was so disappointed she's not going to be here in person, but she will be coming on. And again, my Zoom team will let me know whenever she does get on. And you'll be able to hear and you'll be able to ask questions to her. It'll be an open dialogue. She is in Nacogdoches, Texas. I don't know if anybody knows where that is. It's kind of up in East Texas. And that's where she'll be coming from. And she will be giving you a physician's perspective of Parkinson's because she is also living with Parkinson's, diagnosed at 38 years of age. So it's going to be very interesting to hear her story. We have Cassie with Care Patrol who will be doing our exercise here in just a minute or at the end of her talk. T-shirts, again, if anybody wants a t-shirt, t-shirts are available. We're just asking for a $10 donation. And we're so lucky Lauren is back there and she has managed the t-shirt table. So we appreciate that, Lauren. Thank you so much. And then I'd like to introduce all of our sponsors because how we're able to do these meetings and bring them to you is with our sponsors. They help us financially with the funding, not only to repay the meeting facilities that we have to pay, also, of course, with all of our audio visual and setting up our web license. We have to have a web license. We have to have a Zoom license, all that stuff. But in addition to that, we pay our instructors with our classes. And I'll talk about classes a little bit more. But the first one I'd like to introduce is Jill. And Jill is with Rytari. And I think Jill did not get a chance to make it. But she is very, very good. So if anybody's on Rytari, when she does come, that's a great one to be sure and talk to about it. Amy, I know, is here. Amy is with Acadia and the You Can Just Wait, so be sure to talk to her. And Nuplazid. So if there's ever any hallucinations that you may have, she is definitely the person to talk to. And by the way, all of these sponsors go and visit with your doctors. Whoever your doctor is, they know them quite well. Then we have Medtronic with David Ott. I saw David Ott here earlier. He was here. Oh, doggone it. I didn't even get a chance to visit with him, but he's really, really a nice fella. And he represents Medtronic. So if anybody has a Medtronic device for deep brain stimulation, he's a great one to talk to. We also have Will with Supernus. Supernus is a very strong supporter of us too, but he had a family event come up. A lot of people had things coming up. So I know he's not here today. But I did want to tell you they are sponsoring Meredith Hatcher. So if anybody goes to Dr. Swallow's office, Meredith will be the speaker for Supernus on March 20th, and that will be with the PMD Alliance website. So that's another thing. On my website, I have shared quite a few of the foundations. I recommend that you guys sign up for these foundations. You might think, well, I get bombed with the emails. I understand that. But they offer so many great webinars, and PMDA is a wonderful resource that offers some wonderful resources and webinars, and she'll be the speaker on March 20th. Accorda is here, and we do have a brand new, you know what, we'll have to really be nice to this fella. This is his first week on the job. Yeah. He just finished all of his training to learn all about Embresia. This is Glenn. And so Glenn will be coming to a lot of our meetings. So I just want to say thank you so much. And it's kind of exciting. His first meeting was GAPS, so that's great. And then we have Boston Scientific, but I did not see them. But all of these folks that I'm even talking about are big supporters. And let's see, okay, there's Grand Living. Now, I'm looking for, oh, did I go past it? I know there it is, Abby. I knew you guys. Okay. Okay, so we have Erin, and Erin, as you notice, just a big day coming up here pretty soon. And so she has her backup, who I just met, and I just went blank. Meredith. Her name is Meredith also. And it's with Duopa. And if you have any questions about Duopa, this is a great time to ask these guys. They are the experts on it. And so feel free to be sure and ask them all about it. And when does the baby due? Wow. Now that's dedication to be here right up to I know, that's pretty good. Okay. Anyway, thank you guys so much for being here. Okay, so we'll come right on. And let's see, caregivers, it's just a reminder, we have a caregivers meeting. It's really, sometimes people think, oh, they're depressing. Well, they are true life, but there's a lot of fun and laughter in our caregivers meeting. They are going to be always on the second Thursday of the month, and I encourage you, if you have any questions, please come and check us out. Then our mantra, as you well know, of course, is educate, exercise, and socialize. And I had a suggestion that someone said I should have done it the opposite way, and it would have been the kind of the acronym for C, which would have been super. Except I've got this so much in all of my brochures. I've had to go on and keep it this way. But in any case, this is so important for Parkinson's. And the education is what we do with our meetings. The exercise is all the exercise classes that we offer, and we encourage exercise. And then the socialization is what I just shared about coming at 2:30. We'd really love for you to just come and just visit with us all. I know it might be a little difficult to see this picture up there. It's also usually in my newsletter. But we offer vocal exercise and music therapy, chair yoga, Sun City Fitness, Power for Parkinson offers a fitness class up here in Georgetown. We have art therapy. And by the way, if you even think you might like to do the art therapy, I did check the roster. There are at least 7 more openings. And that's a really, really fun class. So just go to the website or go check out my newsletter. There's a link right there to sign up for it. Because we can have a maximum of 15. But I think we've got 7 openings still. Anyway, it's really a fun class. And that's only once a month. But then we have ping pong. And our ping pong guys, let me see. I'm looking here for Dawn and okay. Are they still going strong? Okay. So ping pong is still definitely going strong, and I need to get some more updated pictures from them, but they have fun. And then we have boxing. We have boxing. We have 413 boxing. I saw Carrie here. Carrie Berger. There she is. Yeah. Boxing is really strong. We really, really recommend that. And if you need a lower key boxing, they have one at the Grand Living with Brittany. But in any case, this is all the exercise. And I had a question asked me. Someone came and asked me a question about exercise and how important it is. Is it really important for a Parkinson person? Yes. Yes, yes, yes. I mean, that is the one thing that research has supported that can actually slow the progression of Parkinson down is to exercise. And I think many of the folks that have done it can truthfully say that when they don't do it, they can feel themselves kind of getting weaker. I also see that we see Beth from Sun City Fitness, and Beth is here. And Sun City Fitness, this is really cool because they have opened up their classes for GAPS, for our Parkinson folks. So normally it's residents only in Sun City. So even if you're not a resident in Sun City, but you would like to take a Tuesday, Thursday class, talk to Beth, or of course, by all means, contact me and I can get you in touch. Okay, so moving right along.
There we
Hey,
go.
I want to be sure and tell you. Okay, many of you guys already know that I have announced my retirement, although, yes, I retired officially, but I know I'll still be very involved and I'm not leaving us stranded by any means. But we're on the search now for an executive director to replace me. And with that, we have actually identified some committees. And each board member, the board members are going to be the leads of the committee, and in some cases, they may have a co-chair on their committee. But we need help. The committees need help. So it's not a major time commitment, but more so like if you have any finance background, maybe a bookkeeper or something like that, just that, something that you can kind of help with. But we're going to get a bookkeeper, so it's not like you have to do it full time. Fundraising and socials, that's kind of a fun one, it's less party. And so that's a good one if you would like to come on that one. And in programs and services are helping to find speakers. And believe me, I have no problem finding speakers. People call us that they want to be speakers. So all of these are fairly easy. If I've been doing them all, y'all can, help out. But anyway, feel free to just let me know if you're interested in this. I will put another blurb out in the next newsletter and you can just contact me. But we're taking volunteers. Now this is time for our speaker to come in. Has she come on yet? Yay! Oh, that's so exciting. Okay. So I am going to do a stop share and let's see here. Okay. Okay. Oh, good. And they're supposed to spotlight her. I see you, Maria. How awesome.
Hi.
Okay.
Can everybody hear me?
No, not yet. So let's get this all here. Maria, can you hear me?
Yes.
Oh, good. Okay, Maria. Okay.
Yes.
So everybody else is muted except for you. And then I'll mute myself for just a minute. Oh, thank you. I need a little audience help over here. Hey, Maria, let me go on and just do a little intro on you real quick.
Okay, sure, no problem.
Maria DeLeon is a fellowship trained movement disorder specialist and was an avid in Parkinson research and got her BA degree from University of Pennsylvania and her MD from Hahnemann. Okay. Parkinson, though, took a personal note for her after her grandmother was diagnosed. And she had then was really working with Parkinson's and getting involved with it. And then noticed that she was developing some of the same symptoms and was diagnosed at 38 years of age. So this is a woman, movement disorder specialist, who also is living with Parkinson's and a physician. So she understands what the patients share. And I've already looked at all your slides, and I will, in a minute here, we're going to go to your slides. I will drive for you, and you just say next slide. And
it's just a guide for people to think of questions and things, because we're just going to talk about different, how to live well with Parkinson's. So
we're going to open it up to the Zoom, but not just yet. And then we're going to let her do her entire presentation, and we'll open it up. And she does have a book, so I'm showing the book to my audience here that next time when she comes, hopefully, we will be getting some books, but I actually have her book. So Maria, if you're ready, I'll go on and start and then I'll mute myself, but I can hear you say next slide, okay?
Okay, great.
So let me share screen. And then they're going to spotlight you and hopefully have you on a side-by-side.
Okay.
Let's see here. We may not have you on a side-by-side, but I think they do on, they will on the video that we're recording. Okay. Show video panel. Oh, looky here. Oh, goodness gracious. Okay. No, I'm not going to remove it, but I'm going to do speaker. There you are. So now here in the meeting, we're able to speak big time.
Okay.
Okay. Let me
Sorry for all the trouble. It's just that, when you live with Parkinson's, you guys know that every day is a challenge. And it's so good to be here. Thank you, Mary. Thank you for inviting me. Sorry I could not be there in person, but next time I try to be there. Um, love Mary. You guys are so lucky to have her. And as she said, I've been doing this for nearly 30 years, working with Parkinson's community uh, as a physician, as a patient, as a caregiver. I myself have had Parkinson's for 17 years, so half of the time. And so I just want to talk to you about what it's like to live with Parkinson, try to live the best life. And you guys are doing all the great things there. Mary was talking about all the programs she has, with art therapy and exercise and voice therapy, and those are all wonderful things. The main thing with living well with Parkinson's, one is to self-care and self-love, and starts with self-advocacy and staying social and active, and that is mentally and physically. And you're doing all the right things by having a support group, by having being involved and doing activities, but also learning and knowing how to get help when you need help, getting the most out of your visits with your neurologist. And we know that, especially post-pandemic, that has been incredibly difficult because so many physicians have retired, have left practice, and neurologists were already short in numbers, and especially movement disorder specialists. And now after the pandemic, it seems like it's even harder to find one and see one. And the visits usually run from, you know, 3 months, 6 months, to sometimes a year to follow up. And so I want you to be well versed and prepared when you do have your visits, and know what to ask so that you can get the most out of living with Parkinson, the most out of your medications. And you have lots of good sponsors there and a lot of representatives there that can help you also understand some of the medications. I have been on almost every single medicine. I can tell you about every medication. The only thing I've not been on is DVS and Duopa. So everything else I've been on, I am on, and I love Ritari too. Mary was talking about that, and that's one of my best favorite drugs that keeps me going. So next slide. So when you go to the doctor, the first thing, whether it's your first visit, your last visit, a follow-up, a second opinion, make sure that you carry all of your medications with you, even the over-the-counter medication. And sometimes not just the list, but actually the medications, because I have discovered many times that patients, especially since we get a lot of generics, they come in different forms, shapes, and colors. And sometimes we can get a little confused thinking that the yellow pill is different than the purple pill. And so we take one of each when both are the same dose, the same strength, and the same medication. And so that can lead us to a lot of more side effects, difficulty tolerating, and oftentimes a lot of unwanted visits to the emergency room because we get psychotic, we fall, we have other problems with it. So make sure you always bring all of your medications to your doctor, to also make sure that you're not taking anything over the counter that is going to interact with what you're taking. And we know, and I know as a patient also, that a lot of times we end up taking other medicines that are not prescribed to us or that we need because we're sick or we have a headache or we have some other pain, and we end up taking other things that the doctors may not know. So that you need to be informing them so they can get the best care for you and avoid side effects and problems down the line. Next slide. So again, the first visit, when you go to a new doctor, whether again it's the first visit to get a diagnosis or for a second opinion, you're gonna bring all your medications if you've taken medications, if you had other tests done, but be prepared. Usually when you go to a new physician, when you go especially to a university setting, that they're going to probably repeat a lot of the tests that you have done. So you may have repeats, MRIs, CAT scans, EEGs, whatever you have done, even lumbar punctures. And if you probably are very nervous and stressed if this is your first time or to be the second opinion, bring someone else with you. Because oftentimes, you know, when you hear a diagnosis or a diagnosis confirmed, or there's any changes, your mind stops working right after you hear the I have Parkinson's, you have Parkinson's, or you have a progressive disease. And then the doctor may spend another 30 minutes talking and you don't remember anything. And so either bring a little tape recorder or someone to be there to be second ears, so that when you leave the office, you remember what the conversation was about. You know, bring a friend or loved one for support. Also, because it ends up the first time, particularly, it ends up being a very long visit at the doctor's, especially if you have to travel to a university. You know, most university settings are several hours. My doctors take 2 or 3 hours to get there, and then you end up, you know, spending time seeing. So end up being a whole day, and you get tired. You need to take your medications, or you need assistance. You need to get food. So make sure you come with someone and be prepared with some snacks or some water and food to make sure that you don't pass out and you don't dehydrate, and you're well taken care of. So some centers also, especially if you travel a long distance, may want to admit people for the first time to run all the tests and not have to come back and forth. So be prepared and ask ahead of time if that's going to be something that you're going to be required to do. So this way you are prepared, not taken by surprise. Be prepared for potential diagnosis. Next slide. Next slide. Mary, yeah. So, and always, if you get any medications, ask for samples or how you can get, because sometimes, you know, these medications are very, very expensive, and you don't want to go spend a prescription, you know, of $100 and then find out that you didn't tolerate the medicine, or it didn't work for you as you thought, or, you know, have to get insurance approval and go through all that and then decide that it was not the right medicine for you. So if you can get at least, you know, a week's worth supply of samples, or how to contact your representatives, your pharmaceutical representatives there, how you can get some medication, some assistance, so that at least you know what to expect with the medications. Sometimes the pharmacies can give you a few pills. You know, if a prescription is sent in, you can ask, you know, can I just get a week's worth supply? And a lot of times they will do that. However, there are some medications that come in preset packages and they cannot be opened. So then those are the ones that you really need to try to get samples. Been given prescriptions, and I said, well, I need to try it. And this is because they said, you know, $700 for a medicine. Well, I don't want to take something that I don't know if it's going to work, or try to argue with the doctor, with the insurance rather, and but they haven't been able to be broken because they come in blisters. Yeah, the next slide, Mary. I was just so remember, PD is a clinical diagnosis, and I'm sure you've heard this a million times, that it is still unfortunately best diagnosed by a movement disorder specialist, 90 to 95% accuracy. However, we're working on some biomarkers. There's a new biomarker that was discovered by the Michael J. Fox Foundation, but it's still not sure how it's going to be used in diagnosing the disease, or how readily accessible it is. So be very precise. If this is the very first time you're going to your doctor to get a diagnosis, be very precise and possible, and start from the beginning. Things that may not seem like they're important, things like, you know, have your family, again, this is why your family is so important. Go ahead, next slide, to find out, even look at old pictures, you know, maybe you notice that, you know, you're not smiling as much, your facial, you know, aspect is not as pronounced as it was, you know, it's more flat, or, you know, you've been tripping more, or you've been complaining of, you know, hip pain, or having trouble going up the stairs, or having trouble with the buttons, or cutting things, or even, you know, cracking eggs. I noticed that when I first started having problems, I could not crack an egg anymore. I was having shells all over my, you know, my eggs, so there were crunchy eggs all the time. I had trouble, you know, with opening jars, and could not even put my key into the door to open it. It was very difficult to do the fine motor of turning the knobs, and forget, you know, putting small, you know, makeup, or shaving yourself, or doing, you know, brushing your teeth is more difficult. The doctor saying, hey, you're having more plaque, your teeth are not as clean as they used to be. So little changes like that doctors are not really going to ask about, but things that have you noticed in your life that are not as easy, like putting on your shoes or wearing boots. And then they're going to do an actual neurologic exam and subsequent follow-up. So next slide. And so these are the things that we're talking about, like the ADLs. You can't put on your pants anymore. It's hard to get into your pants in the morning. They're kind of stiff. You're starting to wear more stretchy pants. You're needing bigger buttons or no buttons, or zippers. Go ahead. Trouble. You're spilling your food all over yourself. You're falling down the stairs, or you're tripping. Go ahead. Keep going, Mary. Keep going. So, and your posture, the one thing that I noticed too myself is that I was not able to sit up straight anymore. Even though when I walked, I walked pretty erect, but sitting, it was hard to sit down. It felt like I was sliding down the chair. It felt like I couldn't really keep my posture back, So notice those kind of changes that may not be very obvious initially. Keep going. That show some deficits. Your facial expression, as I said, your handwriting. Keep going. Of course, with me being a doctor, I always had a bad handwriting, and my handwriting got worse, and my nurses having to do my prescriptions, and they thought that perhaps, I thought initially that because I was a doctor and I was writing all the time that it was very legible, but it became, when I first started medicine, I had very nice handwriting, and I was the only doctor that could be read, and now, suddenly I had the worst handwriting, and people, could not decipher my writing, and I was always not even myself. I still have trouble deciphering my own writing after all these years, and thank God for technology. Next slide. So thinking, and sometimes the thinking is not the obvious of forgetting, but things like you're more irritable, you're losing your temper quicker, you're you used to do math, and now you're having trouble even adding tips on things because you're not really sure, or being able to recognize faces, or being able to think of words when you're speaking. And for me, since I speak Spanish and other languages, I was starting to have difficulty thinking of words in English, and I was having to revert to thinking in Spanish because I cannot easily come up with the words in English of what I needed to say. So things like that, just like being very slow thinking as well, maybe a little bit more anxious, maybe more sad. So things are that, and those are the things also to keep in mind when you do follow-ups that have those things change. Things at home, like things that a doctor's not going to ask, but are you more irritable? Are you having more OCD? Are you hoarding things? Are you more likely to get upset if something is moved from a place that you usually keep it? Or trouble, with see, this is my word finding difficulty, with word finding, or getting, you're not enjoying reading or enjoying music anymore, or enjoying things that you used to just because they bother you, not because you don't like them, but because it just becomes so bothersome to. For instance, I was an avid reader, and it just became so difficult to read, not because I didn't remember the plot, but it's just, it takes so much mental activity to think of visualize in your mind and keep the imagery when you're reading a fictional novel versus a non-fictional. And it's interesting because I really didn't enjoy nonfiction very much as I did, fiction. And now it's reversed because I didn't have to use all that mental imagery to try to think of the story. So think of these things. So what happened at home? Are you not able to, you have to be forced to do your basic hygienes, to shower, to brush your teeth, to go out. It takes longer, it takes more energy to do. So think of those things, as the house, fall apart, the hard to do chores, that kind of thing. So when you go to the doctor, keep those things in mind. Next slide. So never discuss more than 3 topics at a time. I would suggest, 1 or 2 things that are really, really important to you. Things that perhaps may not be important to the doctor. Things like, you're sweating a lot, or you're having trouble, shaving, or you're having trouble, opening, things in the kitchen, or breaking more things, or not necessarily that you're falling or swallowing problems, or, shaking, but things that really bother you, and are causing horrible interference in your life. Keep a diary. And sometimes we know, as I said, it's hard to write. So keep maybe we all have iPhones, I think, and you can just do little recordings, little video snippets, so that you can track it. And when you do that, a second or two, that you can look back and you can see how you are day to day. Sometimes you think you're doing great, but when you look at those videos, you see yourself, you're not talking as loud, you're not smiling as much, you look more depressed, you look stiffer, you look slower. So this way you can kind of gather. And it's not that, every day you're going to have variations, because, sometimes we sleep well and sometimes we don't, sometimes we're dehydrated, stressed, those kind of things. But if it's a pattern that every day at 3 o'clock in the afternoon, I'm not able to get up and move and do the things I need, or I'm falling asleep, or I'm passing out, or I can't drive anymore, I'm seeing double, then those are the things you need to talk about. It's not the once in a while, but the ones that are more consistent. And keep a interest of when you take the medicines. Does it happen before you take medicines, during medicines, after medicines, and what you're taking? So this way they can tailor your treatment to your options. Like I said, can't cook and clean. Ask for referrals to social work and counselor, because oftentimes when we first get a diagnosis, and even when we've been diagnosed for many years, every season has as a stage, at the beginning, first getting the diagnosis and getting the right treatment, then is finding out, am I going to be able to work? If you are employed, am I going to be able to provide? If you're the provider of the home, am I going to be able to have children or not have children, raise children, take care of grandchildren? So all these things, and it affects not just you, the person that has the disease, but also the entire family. So sometimes it's good to have the social workers be involved to see what kind of needs you have in the house. But also, do you need assistance with cleaning? Do you need assistance with daycare? Do you need assistance, counseling, marriage counseling? So all those things that we may not think about, financial counseling, that we need to think about, that is part of the disease in the long term. We don't have to have it all at the beginning, but think about those things, because eventually there's going to come a time where things will happen. And for instance, like myself, I've been very lucky that I have a husband that, takes good care of me. But then during the pandemic, he got very sick. And then suddenly I had to become the caregiver to him. And things that he often takes care of, suddenly I was having to take care of. And so it's important to have those talks with the social worker, with, knowing who does the finances, where things are in case they're needed, because then suddenly, you're going to be left with not knowing what to do, and now you have another person to take care of, and you're going to have to take up that slack. So ask about support groups, and you already know that you guys have the great group there, and that helps. Socializing is the best way to keep happy and to keep your brains and your neurons connected. The more connections you have, the more connections you build, the better you are. Next slide. So again, follow up, did the medications work? Don't forget to bring all your meds. Did you have side effects? How long to kick in? How long did the medicine last? What happens when the medicine is taken? What do you expect to happen? Ask the doctor, because sometimes, we go to the doctor, they give you this medications and they say, take this medicine, come back in 3, 6 months, 9 months. And what happens if you have problems? What happens if I have a side effect? Who do I call? What are the side effects? How am I supposed to take the other medication? So you make sure that you have a plan exactly in your mind, what you're supposed to do and how it's supposed to happen. So if you're given a medicine for tremor, find out, is this going to get rid of my tremor 100%? Is that what we're looking for? Or is it just going to help it a little bit? Or am I going to get less, stiff? Or am I going to be able to be normal? So ask those questions so that you know what the expectations are and how to prepare, and not be dissatisfied and not be unhappy that, oh, this medicine didn't do anything, or this medicine didn't work, or I had the side effects so that you know, and also how to take it along with other medications. Because as you know, this medicines oftentimes cause sleepiness, cause blood pressure issues. And if you're already taking medicines for blood pressure, you know, may not be good to take them at the same time. So you may have to stagger the medicines. Or if it's making your blood pressure go higher, then you may have to take a higher dose of the medicine. Your diabetes as well, because sometimes these medications can increase your sugars as well as the disease. So you need to make sure how to take it along with other medical problems that you have and also other medications. Did the symptoms resolve 100% or partially? And if they change, you know, so now I used to take, for instance, you know, Ritari, and it got rid of my tremors for 100%. And I've been like that for 5 years. But now, you know, when I take it, sometimes it works or sometimes it doesn't work, or it only gets rid of partially of the tremor, but doesn't really, you know, completely get rid of the tremor every single time. So ask those questions and write it down so they can better tailor your treatment and your medications. And also find out how you can access these medications. There are many medications we have now, and so the quality of life can be better, but oftentimes, unfortunately, we are left with the same 5 medicines or 2 medicines we had 100 years ago because of the cost. There are many ways that you can navigate that. It does take somebody to be persistent and somebody to advocate. If you're not able to do it yourself, then talk to the doctor who can help you. There are support programs, there are assistance programs like the PMD Alliance, the Martha J. Fox. They have people that can help you, and they have websites that you can look at to get perhaps assistance of these medications. Okay, so that you're able to get the medicines that you need, because that is the most important thing. These exercises, this therapy, everything you're doing, that really helps, but that's not going to stop or prevent the disease from progressing. And although we don't have a cure, and although we don't have right now a medicine that can stop it, I do believe that taking medications early and on time, and also a combination of medications, it can give you a better quality of life overall than if you didn't take those medications. So we want you to be the best advocate for yourself and have the best treatment possible, and usually requires multiple medications, not just one single time, to get rid of your symptoms, to be kind of a supportive, you know, bridge to keep you going. Next slide. So things to discuss, again, your social, you know, what's going on in your home. Are you having trouble, you know, meeting your activities, being able to take care of your family? The things that are important for you, your motor symptoms. And a lot of times the non-motor symptoms, we hear that a lot, that they're the ones that really cause a lot of problems with people. And we used to think that a lot of the non-motor symptoms were not treated or not treatable with dopamine, but that is not, I have discovered in my own treating of patients and in my own person, that many of the non-motor symptoms respond very well to dopaminergic treatments to increase levodopa, to increase Sinemet, Ritari. So that you need to discuss, especially things like your memory, your mood, as far as, you know, not having that drive to get up and go, your sleep pattern, your restless legs, your REM behavior, that responds very well to dopamine medications. Your inability to think, you know, and be able to communicate, that response to dopamine, and be able to multitask, being able to enjoy music and reading and things like that. And even some of the autonomic problems like having sweating and having bowel frequency or urgency, that also responds to dopamine. So talk to your doctor about what is going on, if that is an issue that needs to be addressed. And talk to them. I know oftentimes we get a diagnosis and then the family too forgets that this is a progressive disease. And then we are surprised when 5, 10, 15 years down the road, we have come to a stage where we need now more assistance, or perhaps assisted living or nursing home or rehab. And we have not thought about that or made plans, and are now shocked that we need those treatments. So we need to periodically talk about the prognosis and the progression and where we are and how to decrease disability and how to, if you need to, apply for disability and whether or not you're safe for driving and the home safety and assistive devices. But as I said, many of these things can be improved with a proper dopaminergic therapy, including balance and falling, and swallowing. So next slide. One of the things that we often forget is, we're so concerned about our motor and non-motor symptoms and talking about whether you're falling or having trouble swallowing or dyskinesias or tremors, but we often forget about things like fatigue, bowel, diet, and sleep, which are very crucial to people that have chronic illnesses, but also very crucial with Parkinson's disease. Fatigue, it can be a combination of things. One, if your blood pressure is really high or really low, your sugars are not well controlled, you're not sleeping well, and so if you don't sleep well, you have more inflammation, so you're going to be more likely to be fatigued. So we need to think about what's causing our fatigue. If all the, sometimes the vitamin deficiencies, B12, vitamin D can also cause this fatigue. So we need to make sure that we are looking at these things. If we address all those things, and as we get older, we also have more likeliness to get thyroid disease or other, medical problems. So once we discover that we have covered all the underlying possible causes and you're still fatigued, there's medications for that, like amantadine. But again, this is one of those that dopamine increase can really improve fatigue. Bowel problems, we have heard this a million times. We know that Parkinson's itself can slow down your GI motility, but also the medications can be very, very constipating. And so we need to make sure that we talk to our doctors about having a proper bowel hygiene. If we need to be sent to a GI doctor, there's many medications like Linzess, Amitiza. There's other medications, probiotics, I think, to help in a lot of people. And so making sure that you have you don't have to have a bowel movement every day, but at least every other day, and that you're having well tolerability of your medications, because oftentimes the constipation accumulates your medications and then that's why they don't function, or you have more side effects. The diet, a lot of people talk about not eating protein, and that, to me, that's really never been an issue unless you're having severe fluctuations. Otherwise, protein is very essential for your body to be able to function, and so you need to have protein. And the best things to eat protein is like eggs, beans, almonds, nuts, those kind of things are very, very important. It give you antioxidants, it give you a lot of energy, and also it helps with your digestive system. I think it's what time you eat is as important as what you eat. As we get older, we don't digest it as well. So, if you eat late, then, you feel a little bit stuffy. You feel like, things don't move quite right. So things that usually help are avoiding things like pastas and breads are much more, and salads late at night that does really tend to be more constipating, that take a lot more energy to be absorbed and broken down. So things that help are like I said, proteins, a lot of protein, a lot of fruit, and some of the vegetables. If you're going to eat vegetables, don't eat them raw because they're very hard to digest. Things like broccoli and carrots and even apples. If you eat the apples, especially if you eat them with the skin, they're very going to be very, very hard to digest, and as well as grapes. So eat them, either peel them or make them into mash, or boil them some, or cook them in the oven, and they're lump where you're still going to have the nutrients, but then they're going to be easier to digest and easier to absorb the nutrients and help you with your bowels. Sleep is one of those big things that we all know that when we have Parkinson's, we can never sleep. I could go 3-4 days without sleeping at all with the Parkinson's, and you think, oh, that's great because I can do a lot and I can accomplish a lot, right? But then what happens? You start walking like a zombie and you can't think right, you can't function right, you can't remember your name. So sleep is crucial in being able to get rid of all that trash in your brain and being able to get rid of the inflammation and being able to process information. So you must get a sleep regimen. And I'm not talking about, yes, trying to go to sleep. We all have, with Parkinson's, your systems, our clocks are forward, are advanced, so that if you used to go to sleep at 11, you're probably, not going to get sleepy till 12, 1 or 2. So, but the main thing is finding a medication that would help you sleep 6 to 7, 8 hours a day, even if it's in the morning, if it's at night, but you need to have that sleep, because that is how you're going to prevent the progression of dementias and Parkinson's, and also the fatigue and the poor concentration. And so you're going to be able to decrease that inflammation and be able to do well. There's lots of sleeping medications that you can try and talk to your doctor about what works best for you. The only one I don't really like with Parkinson's is Ambien, because it builds up tolerance and it doesn't work long term. And plus, it gives you more forgetfulness, and also a lot more acting out your dreams. The other one that sometimes people use is Klonopin, which I don't like long term in older people, because again, it could be it can cause memory loss, and we don't need to have anything that's going to cause you more memory loss, and also causes a lot of balance issues and dizziness, and we don't want to have any more problems walking or falling or getting dizzy and unsteady. But there's about 10, 11 medications that you can try. One of the medicines that I like a lot in Parkinson's patients is Lunesta, because you can use it long term without being addictive. It doesn't stop working, and it doesn't interfere with the other Parkinson's medication. It comes in 3 different doses. But talk to your doctor about, what medicine works best for you, and that one that's not going to make your constipation worse, it's not going to make your memory problems worse, or your inability to walk. So discuss that. Sleep is the number one thing. If you sleep well, you will find that your Parkinson's symptoms are much, much better controlled overall. So that's one thing that we don't, as neurologists, really target that, I am sad to say. So we really have to be more proactive, and you have to talk to your doctor about finding something that gives you at least 6 to 7 hours sleep every day. Okay. And your bowels working. Next slide. And the other thing is that, are you a surgical candidate? We have 3 different companies that have different, Medtronic is the oldest with the DBS. It's been around close to 30 years. We know that DBS works very well. It doesn't, we still don't know exactly how it works, but we know that it does give you a window about 5 to 10 years of being able to control your disease without much progression and without needing so much medication, especially if you're not tolerating the medication. That's one treatment that can lower your amount of medicine that you take. And also it controls, great for tremors, and is great for dyskinesias. And you could have, there's the Medtronics, that's the St. Jude's, and there's the Boston Scientific, and they all have pros and cons. So talk to your doctor about whether you're a surgical candidate. Age is not a relevant contraindication if you're healthy otherwise. It is a surgery and does have some potential risk factors. But overall, especially if you're struggling, if you're having problems, one, tolerating the medications or getting accurate control, this is something to consider. However, the one thing to consider is that where you are located. If you're going to have a surgery of this type, then you have to think about where it's going to be adjusted, how far it is, because unfortunately I have had patients that have had the surgery done and they do really well, but then after the disease progresses and they're not able to drive or don't have someone to take them, then they're not able to go to get the adjustment, so then it becomes a obsolete treatment. So it's important to have somebody that's going to be able. The one fortunate thing is that the one of the DVS, and I don't want to say the wrong thing because I think it's the Supernus, but again, I apologize if I said this wrong, but they are able to provide remote adjustment, so that if you have trouble traveling to the sites to do the adjustments, then they're able to do this remotely, which is a great advantage for people that, you know, are older or not able to drive or don't have, you know, caregivers or people that are able to take them and still be able to adequately use this treatment. And again, it buys you about 5-10 years, so until the next something, maybe a cure or something else happens, it is a great a choice. So discuss your doctor for that, whether you're a candidate. Next slide. The other thing is, you know, always ask, are there any new medications, any new treatments, repurposed medicines? Are you a candidate for clinical trials? I know that a lot of times we don't like to be, you know, some of us may consider, you know, being a guinea pig or, you know, think I don't want to try something new. How is that going to affect me? But there's lots of different trials, some that are medicines that already been approved, medicines that are used for other diseases, and of course, there's new treatments. But ask if there are any trials. The one good thing about this is one, you're going to have a lot more expert care, a lot more frequent care, and this is also going to be provided free. And you may even get an incentive, you know, to be able to do this. But there may be something if you're struggling and having problems with the medications, obtaining it. This may be a way to finance that, to be able to get the treatment, to get the medicines that you need, and to have frequent doctor visits and be able to see if there's any things. Some of these clinical trials can be online, and some of them can be, you know, in person. Some of them are procedures, and some of them are just, you know, doing things like, you know, watching your sleep or watching your eye movements or watching, you know, your breathing or something. So there's different types of trials. So ask your physician, and if you're going to participate on a medication trial, ask if this is going to preclude you from being able to take or any other medications that would this just going to disqualify you from doing things like DVS in the future or doing other, you know, approved treatments. If you want to help out, you know, we're doing a PD generation study with genetic studies, trying to find out. We know that about 15 to 20% of Parkinson's is genetic, and there are different genetic markers, but there's a whole large population that we still don't know the cause. And so we're trying to figure out more if there's more genetic causes. So if you want to participate, there's something you can do online remotely. They'll send you the kit to you. The doctor will visit you online and get you a swab to see if you have any genetic markers that potentially could be used later on for different studies or try to identify cures for specific types. And if you do have, they will give you counseling for free to let you know what this means. So it's important to know what's out there and ask your doctors. Are there, like I said, ancillary studies, you know, things like sleep. I've done a lot of studies where all they, you know, monitor is your, you know, inflammation markers or, you know, your EEGs or your functional MRIs and things like that. So you don't have to necessarily take new medications. Although there's new studies, there's new therapies that are in the works for both gene therapy, where they insert a different gene through a virus to try to alter the disease. And also one is that they're putting stem cells, and there's some, you know, they're doing where they're using your own cells to try to regenerate the abnormal cells. So those are just in the works. They're just starting, and they're one of the places they're doing the stem cells research is down in Houston with Dr. Maya Sheesh at the University of Houston, McGovern Medical School. So if you're interested, you can look at that. Next slide, please. So before you leave the office, again, make sure that you know what's next, you know, the new medications, what's the name, what's the treatment, how are you supposed to take it, you know, what happens if you have any side effects, you know, any doubts you have, who can we call if I think of something, you know, or something happens, and what can we do to, you know, to improve. And can I come in sooner if I need to? Because a lot of times, like I said, they may give you an appointment for 3-6 months, but you may need something in a week or 2 weeks or a month. So you need to be able to know how to reach your physicians and talk to them should you have any problems. Okay, next slide. So again, side effects coming in sooner, emergency samples of medications. Next slide. And that's it. Embrace your awesomeness. It's all up to you. You can handle this, but start with yourself. Have spirituality helps with being able to embrace the disease and live chronic illness. You know, doing the things that you do to support the voice therapy, the art therapy, the exercises. All of those things are wonderful. Staying active, physically, mentally. You cannot. Water that runs cannot freeze, remember, so you must, you know, just keep moving, even if it's one day at a time, 1 minute at a time, and you can get through this. You know, even I, who have 3 other medical diseases, chronic diseases, and live with Parkinson's for 17 years, you know, it is harder as you get older, and you know, you have to manage and juggle more things, but keeping these things in mind and knowing how you feel and writing things down and asking the important questions and always making sure that you have your questions answered and the things that really matter to you being, you know, answered, because sometimes the doctors, you know, what we think is important is not necessarily what we think is important as a patient. So advocate for yourself, let your voice be heard, and if you can't do it, have someone appoint somebody that can speak for you to be able to help you out. So I'm open for questions. Thank you for listening. And how can I help you to
Well, it was
live better?
it was awesome. And hopefully you can hear me okay.
Yes.
Okay, super. Well, you could probably.
We can hear you fine.
Oh, awesome. Do you guys have questions? Comments?
I have a question.
Yes, ma'am.
What is your opinion on thiamine treatment?
Thiamine?
Mhm.
Well, thiamine is a, you know, a vitamin that, you know, helps with B12 and other, you know, vitamins production. It's not harmful to take vitamin B. And actually, if you, you know, people that have, you know, diabetes or neuropathies, it may decrease some of that and improve it. So taking a vitamin B1, thiamine, or it is fine. It's not really going to alter the Parkinson's, but it may make you feel better as far as, you know, making more B12 and giving you more energy and that sort of thing. So yeah.
What level would you suggest? Because I read this book and I can't remember the name of it. I'm sorry, but they had you were supposed to take very, very large doses of B1.
Again, nothing has been shown. None of the studies have been shown to alter the Parkinson's, but I think just taking I think it's like 100 micrograms, which is 1 tablet or 2 tablets over the counter. You know, that's, you know, sufficient every day to provide the needs that your body may have in producing, you know, red blood cells and producing the B12s and that. So because sometimes, you know, especially when we get older, we get to be vitamin B deficient, especially like I said, B12. So make sure you get your levels checked, because oftentimes, you know, your B levels, B12 should be in the thousands. And as with the chronic diseases, and we know that with Parkinson's can get low, and anything less than 400 micrograms can cause other neurological disease problems like paralysis, weakness, memory loss, that may look like dementia. So it's very treatable by taking a soluble, rather a sublingual or injectable or even nasal spray, not just swallow, because it's not going to get absorbed. So it needs to be injected or inhaled to be able to replace it. And that really helps with the fatigue, the memory problems, and if you're having some weakness.
Okay, thank you.
Can you hear me now, Maria? Can you
Excuse
still,
me?
can you hear me now? This is Mary
Yes, I
Jane.
can. Yes,
Oh,
ma'am.
okay, good. We do have some questions here in the
Yes.
audience, but then we also probably have some Zoom questions. So
Sure.
I'm gonna walk with this mic
Okay.
and I'll bring it to the folks. Speak up really close.
I have your book. I've read about half of it. Can you talk about the hormone difference between men and women with Parkinson's? And
Yeah, that's stuff that I'm still, you know, doing a lot of work and investigating. Still, we don't have all of the pieces together, but we do know that when estrogen level drops, so do the brain cells start shrinking, and there's different types of, estrogen, the estradiol and the other, but we know that, especially, I think that that's one of the reasons that when women get early removal of their ovaries and have a hysterectomy before age 40, that's why they have an increased risk of Parkinson's, because it does increase aging, accelerate aging of the brain with lowering of estrogen. We know that also that hormones play an important role with dementia, because we've seen it in women, and Alzheimer's is more prevalent in women as they reach menopause, and then the men, and also have increased risk of heart attacks and strokes with decreased levels of hormones. So obviously it's a very important hormone that we still don't understand fully, and we're trying to figure out when is the best time to replace, according to some of the literature for heart disease, and even for Alzheimer's, that if you replace it within the first, I believe, 3 to 4 years of menopause, it can reverse or improve or increase the risk, rather revert the risk of having dementia or heart disease. But if you wait longer than that, adding the hormone replacement doesn't do anything. So we're trying to figure out how that does with Parkinson's. We don't know exactly, and so we're doing a lot of I'm doing a lot of research on that, and hope to be writing something soon, trying to answer some of these questions. But it's important, I think, that at least I started myself, that started taking, hormone replacement, because to decrease that risk of one, dementia, to possible strokes. And if it does help with the Parkinson's, then I think that it's important, but talk to your doctor, make sure, because some of the doses could have other risks, especially if you had breast cancer, or you had uterine cancer in your family, or a higher risk for getting those. Then we don't want to increase those risks. So, there are pros and cons. You need to talk to your doctor about what's the best thing, to do, and what doses, but and not replace progesterone, because that increases your risk of other cancers, but just estrogen. That is that's what I have recommended. But we know that in women, because they're still having ovulation and menses, that during the cycle, Parkinson's symptoms do get worse. So obviously hormone do play a role, and what exactly and how we're going to prevent it or change it, there's still a lot of questions that need to be answered. So, but we know there's something there, and hopefully in the next several years we'll get some answers. But if you are premenopausal or menopausal, talk to your doctor about whether a replacement could be helpful, and maybe help with some of this cognitive problems, with Parkinson. Also increases risk of decrease of estrogen, increases your risk of diabetes and high blood pressure. So again, decreasing the risk of strokes and heart disease.
Wow, thank you, thank you, thank you. That was really good. Any other questions? I'm looking here in the audience. Any questions here in the audience that you might have? Do we have any questions on Zoom? Deb and Don, do y'all see any questions there? Is
I
there
hope I didn't
anybody?
bore anybody. I hope I didn't bore
No.
anybody, and just
No, it was
Can I-
incredibly interesting. I think we have a question coming in.
Can I ask one more question?
Sure.
Can you exercise too much?
Well, my husband is here. He probably would laugh at me. But the thing is that when you do everything, you have to do it in moderation, and you have to consider your body state. Sometimes your body is just really fatigued and really tired, and you're real stiff and slow, and you're going through other things. You should kind of learn to see what your body is telling you. If you're you know, really already stressed and haven't slept and, you know, dehydrated and you're weak and shaky and falling, probably not the best time to be exercising. You know, but certainly anything with moderation. And but remember, exercises for Parkinson's that really are helpful are stretching exercises, balance exercises, you know, cardiac workouts, you know, may be good for your health, you know, as far as your heart, but they don't really do anything as far as the Parkinson's. You know, so doing water therapy, I really like in the deep end because it really improves with the helps with the pain, the stiffness, and the balance. Doing exercises, walking backwards, but of course, I would not do this unaccompanied or alone or without a physical therapy. That really helps with the balance and with your walking and your freezing. But you know, anytime you exercise, I think part of the exercise improvement that you have, one, you're lowering your blood pressure risk, you're lowering your heart rate, you're lowering your sugars, so that all improves, you know, your overall well-being. But also, if you're doing it with a group of people, that's socialization. Number one, you know, socializing, interacting, that is most beneficial for anyone to improve, you know, well-being and mental, you know, well-being. And so just keep in mind, because I've seen people that just go too far and then they end up falling after their exercise and end up with traumas, you know, in their head or their hips. You know, it's good to exercise, but everything in moderation and when you feel well. And if you're going to, you know, remember, you're going to be pumping a lot of dopamine and endorphins when you do it, but then when you stop doing it, everything's going to crash. So you need to be able to have enough in your system, be able to, you know, avert that crash so that you don't fall afterwards and hurt yourself. So
Thank you.
Wow. Yeah, that is good. Somebody asked me a question and I'll go on and hopefully you can hear me okay.
yeah.
Sugar, because oftentimes people crave sugar, but at the same time, they heard it wasn't good for Parkinson's. What is
Yeah,
your,
and you know what I've discovered, that I know because my grandmother was diabetic and she always, I thought it was because she was diabetic that she craved the sugar, and I started craving sugar. But what I've discovered in my own personal, you know, living with Parkinson's and dealing with Parkinson's is that when I start craving sugar is because my dopamine is low. When you intake sugar, you get a big boost of dopamine surge as you break the sugar. So what I've discovered is that that when I start doing that is because my dopamine, I start looking at, you know, when I take my medicines, how much medicine, and then I just did, you know, talk to my doctor and adjust my doses and increase my dopamine, and that craving stops. So I think that's one of those signs that is telling you that you need more dopamine. And so you need to, you know, talk to your doctor about, you know, what's going on and why you're doing that. Of course, you know, sometimes stress, we do that because we're depressed or things, but I've learned that when that constant, you know, surge, especially if it's coming, it happens every time at, you know, 6 o'clock in the afternoon, or, you know, and look at your medicines where you're taking it, you know, is it dropping off, are your levels dropping, was it before you take your next dose, you know, so you may need to adjust to a higher dose or take it earlier or something. But I have discovered in myself that when I bump up my doses of the dopamine, that craving for sugars goes away.
wow, now that is really good. Whew,
Yeah.
now I know why my husband craves ice cream at night. I'll
Yeah,
just get
no,
him a
you know,
pill
you
next
scream, yeah,
time.
you want to, I was always craving, you know, I love chocolate and I always talking about chocolate, but I'm not a big, like, you know, even though I talk about it all the time, I'm not always eating chocolate. But when I started craving like some chocolate or something sweet or, you know, caffeine also, it all those things give you a big boost of dopamine. And so when I am on a higher dose of dopamine medication, then I don't have those cravings at all.
Super. Another question though that has come up, as a physician and also as a person with Parkinson's,
Yeah.
what suggestions or recommendations do you have for the caregiver to better help?
Yeah, I know. And I have my husband here. So, you know, I really think that we need to, well, one, you know, is your caregiver your spouse? Or is your caregiver your, you know, your family member, or is it a friend? You know, so you have to kind of think about who your caregiver is. But also, I think that the more independent a person is with Parkinson's, the better they will do overall, unless they need, assistance. Because oftentimes I find and I see that, perhaps the person that's taking care of the patient, gets really, gung ho as to trying to fix the problem or trying to take care and do everything for them. And then what happens? They burn out. And this is a disease that is not a sprint but a marathon of 15, 20 years. And then what happens when the patient actually needs, gets to that third, fourth stage, fifth stage where they're actually not able to walk, move and stuff, and now they're not having a caregiver because they're burned out themselves. So it's still keeping, open communication is number one, being able to talk about the needs of each other. It's not all about the patient, even though sometimes we feel like it's all about us. We need to make sure that we also, take care of our loved ones who are taking care of us, because if they're down, then, we're going to be in trouble ourselves. So that we do things separately and together, especially if you're a couple. And especially, if you're still young, try to maintain that. And it's hard, when you're really young and you're sick, trying to maintain that kind of, mystery and that kind of, still that romance, because, once you become a full caregiver, they're taking care of you, that romantic part kind of goes away, right? Then you're not really thinking of them or seeing them as a, a sexual or romantic partner, but more of, somebody that you're taking care of. So try to have independent goals and dreams and come together, and that they have to have their own life and freedom and do things. And one of the things initially, I was upset because my my schedule is so crazy. The only thing predictable about me is my unpredictability, my husband tells me. So is that I wanted everybody or him to be around when I was ready to go and do something. We can't have their lives waiting around, sitting around for us to be ready to do something. So they have to be able to do their things and then kind of schedule or decide, okay, today we're going to try to do something. But there are times I go to the doctor myself. If I need to, I get a friend, I get somebody else to drive me so my husband doesn't have to do that. Only in situations where I'm completely had surgeries or been completely down, that I need my husband to be my caregiver, where it takes care of me, and then try to go back to everybody independent. But I think that's probably the best thing, to still be partners and understand each other and understand each other's mood and know what everybody's doing and taking, but still not be trying to manage their life all the time, unless they're at that stage where they're now needing assistance with with eating and feeding and cleaning and things like that. And even then, maybe time to consider some assistance help outside so that they don't completely burn out. At least that's my opinion.
No, I think that's wonderful, and I really appreciate you sharing that perspective. We have a caregivers group here, and many times things come up like that, and that's wonderful. I see many of my caregivers here that will probably follow up and discuss this
Yeah,
at our
because
next meeting.
you just burn out. Because I tell you, when we took care of my grandmother, she had Parkinson's for about probably a good 15 years at least. And she came to live with us when my grandfather passed away. And I thought, I was the best person to take care of her because she had Parkinson's, but then realized she ended up with also a brain tumor. So that kind of, changed the perspective, and she became completely bedbound. And I had to feed her, and we had to change it. And thank God, my husband helped me with that. But and we had home health, and we decided at that time to keep her in home instead of putting her somewhere. So those are decisions you have to take, whether you want to keep him in the house or put him in hospice, or put him in nursing home, or are difficult decisions. But you have to think about the support yourself, and I was working full time and I had a toddler, and so it was very, very hard. But it is even though I had help all week, but when I came home from work and my husband came home from work, we would take care of her ourselves all night and every weekend. So it really wears on you, even though we love doing it, and even though it was my grandmother, and she raised me, so it felt like a mother. But it's difficult when you are bound to that all the time, especially somebody's bedbound and you can't go out or you can't leave them, and they're psychotic, hallucinating. It really really does take a toll. So you need to make sure that you have somebody else to share that burden with, that you're able to have at least an hour for yourself of the day where you are, decompressing, and not having to deal with that, because otherwise you're going to get sick. And then who's going to take care of your loved one if you're ill? So.
Good points. Excellent point. We do have another question right here. I want to speak real.
Excuse me. Hi. I had a couple of questions. One of the questions is in genetics.
Yeah.
My dad had essential tremors. My oldest sister has essential tremors. I have essential tremors, but my niece has Parkinson's.
Yep. I know. I have family history of essential tremors. It's funny, my grandmother had essential tremors. She started in her 40s. And then after, 15, 20 years of essential tremors, when people have essential tremors, there's a greater risk of developing Parkinson's. How much of a risk, I don't know, but there is, especially the longer you've had the essential tremors and the younger you started, you have a higher risk of developing. My grandmother developed Parkinson's after essential tremors. I don't have essential tremors, but my mother does, my sister does, all my other family does, but I ended up with Parkinson's. So they certainly do run, in the same genetic configuration. Unfortunately, I'm sorry, they have not found a specific gene for it. So I can't tell you, is this gene or it, but that's why we want to do more genetic studies and people that have this, so maybe we can find a gene and we can find what causes it so we can prevent it or find, specific treatments and cures for this. But yes, they run in the same family, unfortunately.
Thank you.
Mhm.
Also, how much does inflammation of the brain figure into Parkinson's?
Well, that's again one of those things, because I don't think that the reason we don't have a cure for Parkinson's is because it's a heterogeneous disease. It's kind of, you've seen, everybody talks about, you've seen one Parkinson's patient, you've seen one Parkinson's patient, because everybody's different. It's because there's very many different causes. I believe Parkinson's is like cancer of an organ, where you have, for instance, breast cancer, but then you have different types of breast cancer, and I think Parkinson's is the same way. And that's why, we have genetic causes. And I do think that there are some inflammatory causes. People that have other autoimmune diseases like lupus and ulcerative colitis and other autoimmune diseases have a higher risk of developing Parkinson's. And again, those run more in women. So, people that have migraines have a higher risk of developing, Parkinson's. So there's different markers. And so that's why we're trying to, the LRRK2 gene, they have a higher risk, but we don't know if it's a 20% risk or 40% risk. It's not a full penetrance. Just because you pass that gene on does not mean that the person that has it will develop Parkinson's. But it has been linked to inflammation. So definitely inflammation. And I think that's why it's important that we talked about sleep, because sleep is where lack of sleep causes increased inflammation of the brain and the body. So that's one of the things that I think that really makes the Parkinson's worse, because you're not getting enough sleep and you're increasing your inflammation. And also estrogen, we talked about earlier, is involved in inflammation. So there you go. I think that inflammation definitely has some moderation. And there are studies where they looked at treatments with anti-inflammatories, or autoimmune diseases to try to see if we can improve Parkinson's. Some are still underway with some autoimmune biologicals. I don't know which I don't remember right now which centers are doing it, but replacing things with like anti-inflammatories or vitamin C, vitamin D, vitamin E, which are involved in inflammation, have shown some improvement, and even coenzyme Q in some subsets of Parkinson's can help the disease. Not in everybody, because I don't think everybody has the same etiology or cause of it. But yes, that's why sleep, I think, is so crucial.
All right. Dr. DeLeon, this has just been awesome. And I know there's probably even more questions. There's a good possibility, will you be coming to the all-in that PMDA?
I just found out about it, that they're gonna have it in Austin in November, is that correct?
Yes, ma'am.
So,
And
so I'm
so
hoping, yeah, I'm hoping to be there, yeah. So.
there's a good
I'm
chance that,
looking-
yeah, that you'll probably be a speaker. I'm sure they're gonna ask. So I'm gonna be keeping you guys well informed on that so that y'all can attend also and do
And
it. But
hopefully by then I will have a new book that I'm working on, a book about my life stories, just stories, journey of Parkinson's and life and and faith. So hopefully that book will be out by then. So
all right, well, I'm going to now, just to continue with our meeting, this has been great, and again, a round of applause. We appreciate it so much. We have recorded this, and I will be sending it out in the next, newsletter, and of course, you'll see a copy of that too. Feel free to share it with anyone among your, customer, or your, patients. But
Yes,
I'm gonna
please.
go on now and switch back, so I
No
will,
problem.
but stay with us here, and you may want to have to mute yourself just so that it can get going, and let's see here. All right.
Thank you, everybody. Thank you for having me.
Mhm.
And
Okay.
I'd love to see
And
you
if-
guys
if-
in person sometime.
Okay, all righty, and let me see, let's plug in the camera here. There we go. All right, slide. Okay, to thank you. That's our mantra. There to exercise, educate, exercise, socialize. And now this is the slide I was looking for. This is Cassie. Where is Cassie gonna be? Right there. And Cassie is with Care Patrol. She's also a physical therapist as well as a certified personal trainer. And I'm gonna let you speak here, and if you want to be up front, okay? And hopefully, now I'm gonna do the stop share, and hopefully this. Okay, we got our camera working. So we may need to bring the camera up a little bit more so that we can get her. Can you hear me in the back? No, well, we need to have this for the. I know, it's really tough, Cassie, I know it.
All right, feel free to stand if you're safe standing. Lacey will be doing the standing exercises. I'll be doing the seated exercises. No falling. And Carrie, maybe you can help keep an eye on people in the back. Each exercise will be about 30 seconds.
That would be up close.
Is that close enough?
Mm-hmm.
We're gonna start with going up and down with our head. Nodding yes. Yes, I love exercise.
Yeah.
Yes. About 30 seconds here. Don't get too crazy on me. Good. Keep going. Perfect. About 5 more seconds. Now we're going to shake our head no. Do you like snakes? No. Just go gentle. Don't hurt yourself. Good. All right. Who here holds all their stress in their shoulders and their traps? Let's loosen those up. Let's do some shoulder rolls. Start small and get bigger. Breathe while you do it. Do some music. Stands in the front row. You should be up here. Let's go forward. I know a lot of you are going to Carrie's 413 Fitness. I've heard some great things. So keep going if you can. In fact, let's pull a move out of Carrie's book here. Let's punch. Don't punch your neighbor. Good. I like how some of you are getting some rotation in your back through it. Good job. Stan, I see that. Good. Keep moving. Good. Now we're going up. Good.
Feel the Zoom crowd, they need to be doing this too.
I know. The Zoom. I see you now, Kevin. Keep going. Good. Keep moving. About 15 more seconds here. Now we're going into our spine. We're going to try to look behind us, rotate, don't fall. Start small and rotate back. Good. Try to look behind you and say hello to the person behind you. Now we're going to go side to side through our spine. We're going to be little teapots. Keep going, Gary. I see you. Good job. Mary Jane. Keep teapotting. Feel your back loosen up. Good. One more for the spine. We're going to reach down, but be careful on this one. Don't reach too far. Just if you're sitting, bend forward and reach. And if you're standing, watch Lacey. Don't go too far. Nose over toes, like Stan says. Good. Perfect. Keep moving. About 15 more seconds here. The puppy's helping in front. Yeah. Downward dog, yep. Keep going in 3, 2, 1. We're going into our legs now. We're gonna march. Try to sit up tall if you're sitting. Keep your tummy tight. Even if you're standing, we always want our tummy tight. Protect our back. Good. Get those knees up. This also works on balance. This is a good one to do slowly while you're brushing your teeth. Good. Get those knees up. Perfect. Oh, yeah. Mhm. 10 more seconds here. Carrie, I see that arm movement there. I like it. She's getting into our compound movements. All right, next one. If you're sitting, we're going to kick our legs out. If you're standing, you're going to bend your legs back. You're going to bend your legs back. Yep. So sitting, kick those legs out. Standing, bend those knees. Good. Keep moving. We got 3 more after this. Ten more seconds here. Get the blood flowing, especially because a lot of us, like me, sit all day. All right, we're switching to up on the toes. If you're standing, be careful with this one. Up on the toes, we're gonna get a good calf blast. You have great posture. Which one? Raise your hand. Got called out, yeah. Up on those toes. Nice job, Stan.
To the ballerina.
Were you really a dancer? We have 2 more. These are going to be our compound movements. So we want to kind of go fast, but don't fall. Be safe. Okay? The first one, leg out to the side, arm up. We're going back and forth. These are some dance moves. It should be opposite, but I have the mic and I'm doing it wrong. John Travolta's, thank you, Carrie. Yes. Stan, you got this move, damn. Come on, whole body moving here. There we go, 15 more seconds. Good. It feels good to get the body moving. I feel better already. 5, 4, 3, 2, 1. Perfect there. Last one, high march and a punch, okay? Out of Carrie's playbook. If you're sitting, it's a bend your knee punch. And if you're standing, follow Lacey. Last one, keep your balance. This is coordination, balance, full body. Keep your tummy tight. Big steps. Keep your balance. Good. We got about 15 seconds left here. Nice job. Good. And to finish, we're going to give ourselves a wild round of applause. Nice job, y'all. Thanks for having me.
Thank you, Cassie. That was wonderful. Really, really appreciate that so much. Just to let you know, I'm gonna do a quick share screen right here so that you can see. Invite you can see the crowd. Well, we had a even larger crowd, but everybody's getting ready to leave. You know, I think they might be getting ready to leave because they think they're gonna have to put up chairs. Huh. Well, they're right. But anyway, we will come over here just super quick. Let me do everything. This is wonderful. So again, we want to thank Cassie very, very much. And